Joining us now on NDTV is our newsmaker Amitabh Kant, CEO of the NITI Aayog. Mr. Kant, thank you for joining me. What, sir, do you think is the situation today? Just as India opens up, India is now restarting to a new normal in a sense. Where do you think India stands today?
No, I think it's been a very, very tough and a very complex job of trying to save lives of people from coronavirus, and at the same time trying to ensure that people get livelihood, the economy gets back on track, that we are able to keep our mortality rate and our fatality rate extremely low, and ensure that we do not lose jobs. We are able to take care of our migrant population. We are able to ensure that everybody gets food as well as their jobs are intact. And therefore, it's been a very, very challenging time for the government.
Do you find, Mr. Kant, that today when you look, you said it's been a very challenging time for the government. We are now entering a new phase, which is, as we say, when India opens up at a time when cases are still, in a sense, exponentially rising, where the peak is expected to be, or the curve to be flattened towards the end of June, early July. So in that sense, our earlier projections reflected something different. We're now coming to phase 2 with numbers of over 1.5 lakh. How challenging is this phase ahead for you?
So, Sonia, I must say that the country has done extremely well when compared to all other countries of the world. I think what we were able to do is that we were able to contain the exponential growth for a long period of time, and because of that we gave ample time for adequate preparation across the states. When this started, we did not have PPEs, we did not have masks, we did not have ventilators. And because we were able to, that time, flatten this exponential rise, this gave us ample time. If you look at the fast and rapid rise of testing from about 1,500 to about over 1 lakh plus now, if you look at the large-scale manufacturing of PPEs domestically, if you look at the large number of ventilator orders which have flown to domestic companies, I think this has been a remarkable job which the domestic entrepreneurs have done, and we've adequately prepared ourselves. But the important thing is that if you look across the world, India's mortality rates are amongst the lowest in the world. It's not, to my mind, a question of the number of cases. The virus may move from one place to another place because of mobility of people as we go along. But the challenge would really be to take care of our elderly people, of people who have comorbidity, of people who have suffering from other ailments as well, so that we ensure that our mortality rates, which are very low, remain low as compared to any other part of the world, and that is really the big challenge.
So I think that's a very important point to stress, that our mortality rates, our recovery rates also of over 40%, and the fact that our mortality rates are low. In fact, today at the press briefing, the press conference, they said that almost up to 78,000 deaths have been averted, 14 to 29 lakh cases have been averted. But is that a bit of jugglery of numbers now? Because is the big focus really, when you talk about that we are well prepared, we know that Mumbai has said, Maharashtra has asked that private hospitals, that they almost in a sense that have to give 80% of their beds, that there is a worry in urban centers, which is where right now the virus is focused. Gujarat, Mumbai, Delhi not so bad yet. The worry about adequate beds and our hospitals being prepared, and with migrants going back to UP and Bihar, if the cases rise there, the health infrastructure is just not in place.
So, Sonia, if you look at today's figures, about almost 19 cities in India account for about 72% of the total cases. 5 cities actually account for about 50% of the cases. And therefore, the challenge really is in these 19 cities. Mumbai itself is accounting for about 33% of the cases. And to my mind, the challenge really is in Maharashtra, where Mumbai, Pune, Thane, Nasik, particularly Malegaon, these 4 cities will make a huge difference. And therefore, a very, very, localized containment strategy, very, very intensive containment strategy is critical now in these cities.
It's almost about hyper-localizing when you're actually tackling this, in a sense, is what you're saying. But let's just shift the focus to the economy. The RBI governor announcing again another major rate cut today, trying to inject liquidity into the system, lending more. But there have been disappointment from many sectors. I had the top people of the tourism sector just now saying we got absolutely nothing in the 20 lakh crore package. When are we actually going to address the liquidity demand, the economic impact of the coronavirus, and also the worrying issue of jobs being lost across sectors?
So, Sonia, it's important to understand that the government has done a lot, and there's been a very coordinated action between the fiscal policy and the monetary policy. You've seen some very, very positive action by the Reserve Bank governor all throughout this crisis. He'd taken two different actions earlier, and he's taken one today. He's cut down the repo rate further to about 4%. He's extended the moratorium. The government has separately come out with 5 key packages. They've taken care of several welfare measures. They've brought in a lot of major structural reforms which will pay India rich dividends. Now, there is obviously a request from several sectors of the economy, and as you would have seen, that the government has tried to provide large-scale liquidity through several packages, but not touched at individual packages. I think this should wait for some more time. There's a demand from travel and tourism which has been badly hit. So has been aviation and many other sectors. But I think sectoral work has not been done, and rightly so, because it was important, very, very important to first take care of the MSME sector. It was important to take care of agricultural sector. It was important to take care of the welfare of the people living below the poverty line. All that has been done. And I think as we go along, the monetary policy probably and fiscal measures will touch upon some of this as we go along.
And finally, Mr. Kant, when we look, I think there are no two views that the lockdown was needed. It came early. India was in, the India model drove that in the world's biggest lockdown. But the humanitarian crisis which emerged, what do you think has been the government's biggest success in this last 2 months? And I would say the biggest failure. Has that been the migrant humanitarian crisis that we still see people, women, children walking home in this heat, kilometers state over state? Could that not have been averted?
So, Sonia, firstly, I would say that the biggest positive has been the way the coronavirus crisis was handled. It required tough political decisions. It required all India approach, a whole of India approach, which the Prime Minister has regularly done by interacting with the Chief Ministers. And it required everybody to work in a very united manner, which has been done. And I think one challenging factor out of all this has been an area of great concern to everyone on the migrant crisis. Now, it's important to understand that this was a challenge because over the years we've created laws, to my mind, which have led to a huge amount of informal workers in our economy. We should have laws which ensure formalization of workers, not informalization of workers. And secondly, there was a big challenge because there was, this whole issue of the virus spreading all over India, and therefore some states were wanting to transport workers, and the states where they had to be received were not willing to accept the workers. The cities, the districts, the rural areas were not willing to accept because there was this fear that the virus would spread all over. And therefore, there was a massive challenge. And I think, to my mind, this united action, and this was essentially the role of the state governments to ensure that workers were well taken care of. You know, in a vast country like India, the federal government has a limited role. It has a role as far as the macroeconomy is concerned. Right. But individual state governments needed to have taken care of. But this was a challenge where I think we could have done a much, much better job of taking care of every single worker at the state, the district, the municipal, the local level. But we did a lot. 92,000 civil society organizations and NGOs were mobilized. All of them have provided foods. Civil society organizations have worked individually, and many states have done remarkable work. But this was one issue where we could have done much better.
Right. Well, as we go, as I say, into phase 2 of this, when we look at hoping to reach the peak, to flatten that curve, it will be another very challenging time. Mr. Kant, we hope to have you join us again on the latest on that. As we said, the bad news, cases going up, but the good news, the mortality rate still low as compared to our population, the number of positive cases, and of course, the issues of the lockdown, cutting down on deaths, cutting down on cases, but the humanitarian issues as well. Thank you, Mr. Kant, for joining us at a very challenging time.